Risks associated with grade 3 maturity pregnancy.
In this video, we'll be discussing the risks associated with grade 3 maturity pregnancy. As a pregnancy progresses, the placenta undergoes a natural process of maturation. Grade 3 maturity refers to a placenta that has reached an advanced stage of maturation, which can sometimes occur earlier than expected.
What is grade 3 maturity?
Grade 3 maturity is the final stage of placental development, characterized by calcifications and other age-related changes. While it is normal for the placenta to reach this stage by the end of pregnancy, complications may arise if it occurs too early.
How is grade 3 maturity diagnosed?
Diagnosis of grade 3 maturity is typically done through ultrasound imaging during routine prenatal visits. The healthcare provider will look for signs of advanced placental maturation, such as increased calcification and decreased blood flow.
What risks are associated with grade 3 maturity?
There are several risks associated with grade 3 maturity in pregnancy, including 1. Decreased nutrient and oxygen supply. As the placenta matures, its ability to transfer nutrients and oxygen to the baby may be compromised, potentially leading to intrauterine growth restriction, IUGR, and other complications. 2. Preterm birth. Early placental maturation can be a risk factor for preterm birth, as it may indicate that the baby is not receiving adequate nutrients and oxygen. 3. Low birth weight. Babies born to mothers with grade 3 maturity placentas may have low birth weight, which can be associated with various long-term health issues. 4. Placental abruption. In some cases, grade 3 maturity can increase the risk of placental abruption, a serious condition where the placenta detaches from the uterine wall before birth. 5. Stillbirth. In rare cases, grade 3 maturity may be associated with an increased risk of stillbirth.
What can be done to manage these risks?
If a pregnant woman is diagnosed with grade 3 maturity, her healthcare provider may take several steps to manage the associated risks, including 1. Increased monitoring. More frequent prenatal visits and ultrasound scans may be recommended to closely monitor the baby's growth and well-being. 2. Corticosteroids. In cases of preterm birth risk, corticosteroids may be administered to help mature the baby's lungs and decrease the risk of complications. 3. Induction of labor or cesarean section. If the healthcare provider determines that the baby is at significant risk, they may recommend inducing labor or performing a cesarean section. In summary, grade 3 maturity pregnancy poses certain risks to both the mother and the baby. However, with proper monitoring and intervention, these risks can often be managed effectively. Always consult with your healthcare provider if you have concerns about your pregnancy.